ECG quiz on a wide QRS rhythm. Here is an ECG showing a wide QRS rhythm. What are the findings and interpretations? Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. P waves can be seen at a rate double that of QRS complexes, marked by blue arrows in the rhythm strip. They are inverted in inferior leads, indicating an ectopic focus from the low atrium. This would suggest an ectopic atrial tachycardia. 2:1 conduction excludes the possibility of an AV node mediated tachycardia, which would get terminated with the onset of AV conduction block. The QRS is very wide, 200 milliseconds, with a tall slurred R' wave in V1 and a slurred S wave in leads 1 and AVL. These indicate a complete right bundle branch block. QRS has right axis deviation suggestive of left posterior hemiblock in addition. Fragmented QRS is visible in inferior leads as multiple notches in the QRS complex. All these indicate a high risk for ventricular arrhythmias. Such wide QRS is often noted in post-operative cases of tetralogy of Fallot. It is well known that adults with previously operated tetralogy of Fallot can develop ventricular tachyarrhythmias and die suddenly. They are prone for ventricular tachycardia as well as atrial tachyarrhythmias like atrial flutter and fibrillation. Syncope may be a forerunner of sudden death in some individuals with operated tetralogy of Fallot and calls for evaluation. An annual incidence of 0.4% sudden death during the first 25 years after surgery has been reported. Both the surgical scar as well as the dilatation of the right ventricle and right atrium due to the pulmonary and tricuspid regurgitation are thought to have roles in arrhythmogenesis. Highest risk is in those with marked cardiomegaly, cardiothoracic ratio more than 60%, severe pulmonary and or tricuspid regurgitation, QRS duration on electrocardiogram of more than 180 milliseconds, and a QT interval dispersion of more than 60 milliseconds. In the ECG illustrated here, the QRS duration is 200 milliseconds and comes in the high risk category. Surgical correction of pulmonary regurgitation with a valvular prosthesis and tricuspid regurgitation by annuloplasty may decrease the chance of atrial and ventricular arrhythmias. This is more likely if surgical repair is also accompanied by mapping and ablation of the re-entry circuit of arrhythmia. Here are the first set of relevant journal references. One more journal reference is here. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.